Okay, a lot of parents ask me, how do I know if my child is sick? They're worried that they're going to miss it. And I can understand why that is because a lot of times people feel like their baby's going to throw a surprise at them or they're going to miss something. And I would challenge you first and foremost to drop that line of thinking that you're not going to know if your baby is sick or you're going to miss something important. Because, yeah, you are their parent, and you will have great intuition, and you will know if something is going on with your baby that's outside of the normal because you're going to be around them, especially in those first few months when parents are especially worried about their baby getting sick. You're going to be around them a lot, and you'll say, "Wow, that's kind of different." And one isolated thing that's different, one bad feeding, or one big blowout diaper, or something unusual, usually doesn't mean anything. But you'll notice a pattern and say, "Geesh, we're not really feeding as well today, or we're not doing the things that we usually do, or we're less active than usual. I'm going to keep an eye on that." But parents ask me a lot, how do I tell if my baby is sick? And I give them three specific things to ask themselves. And if those things are normal, then they can be reassured that they're not going to miss something and they've got some time to think of it. So first and foremost, for babies, I tell parents to think about, okay, how are they feeding? Babies that are sick do not feed well. And so if your baby is feeding well, then I know we're talking about feeding, aren't we? If we're talking about if your baby is feeding well, then that decreases the likelihood that they're sick or that there's something going on because sick babies don't feed well. Secondly, breathing. If your baby is breathing like normal, is having breaths that you can hear, is making plenty of noise, is not breathing too fast persistently or too slow persistently, then those are reassuring things too, that there's nothing big that we're going to miss. And so you look at the baby's breathing and you say, okay, they're breathing at a normal rate, or they're a little bit fast, but then they calm down because babies will have periodic breathing where they have periods where they breathe fast and then periods where they breathe slow. And you kind of have to average it out and look at it over time. But that's the second thing. So breathing, if their breathing is normal, if they're breathing really hard persistently, or if they're barely breathing and not arousable, then those are two things that would give you more pause and more concern. And you would notice those. Those would not surprise you. And then lastly, are they vigorous? And by vigorous, I mean, do they have some spunk in them? Do they have some fight in them? Or are they just a limp noodle that doesn't really do much and sleeps all the time? So babies that are vigorous, you pick them up and they scream. That's a good sign. They, have some good tone. You can hold them up and they hold their bodies up a little bit on their own. Now, most babies are not very strong and they'll kind of sway or fall to the side when you hold them up, but they do have some good muscle strength. So if you have a vigorous baby, that's also reassuring. In contrast, if you have a baby that's like a limp noodle that you can hardly wake up, that if you try and tickle them or push on them, then they don't do anything, then those are more concerning things. And you look at the constellation of things. You don't look at just one thing. But if you've got a baby that's feeding poorly, that seems to be breathing differently, that's not vigorous, then those are things that require more immediate attention. If you're wondering what should I do about my baby and you're not sure, then call your pediatrician and ask. And hopefully they have an after hours line and you can get the information that you need, even if their office is closed. The one thing that I'll tell you is that regardless of how they look, if a baby under the age of 1 month has a fever, and a fever is 100.4 taken rectally, then that's a more serious thing. So 100.4 taken rectally under a month is a trip to your doctor's office or a trip to the emergency department if it's after hours or if your doctor's office wants you to go there. The reason for that is because babies under a month of age, their immune systems aren't as well developed. They're at higher risk for serious bacterial infections. And so if they're under a month of age and they have a temperature of 100.4 or greater, we're going to instruct them to go to the ER. They're going to get lab work done. They'll get a urine culture done, which involves a catheter. They'll usually get a spinal tap too. And then they'll get admitted to the hospital for antibiotics until things have cleared up or we've got an idea of what's going on. So I don't mean to worry you with that. That is very unlikely to happen. I've been in practice for over 5 years, and less than once per year do I have a baby under a month of age that has a fever that then requires admission to the hospital. So the likelihood of that is low, but I wanted to make you aware of that. The biggest three things: are they feeding well? Are they breathing okay? And are they vigorous? And if there are those three things, then you've got time to watch and see how things are going, to trend it out and talk to your doctor's office. I hope that's helpful. Please comment below, share with somebody else that's not sure what to do as a parent, and take a moment to share the experiences that you've had with your baby when they've been sick and when they've been well, and what gave you pause and what gave you reassurance. Share some comments below so other parents can see what's going on. And enjoy a little Gloria time before we end. Yeah, look at you. She says, I'm done with screen time. Keep up the good work.